The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
COVID-19 second wave began well before the holidays, but it is now slamming us hard here in Ontario. As we stare down a new round of restrictions tonight, we'll ask if they're enough to make a dent in this phase of the crisis. And with hospitals approaching capacity, our Ontario hubs take another look at how doctors will decide who does and doesn't get access to the finite supply of medical care. Then from foreign affairs to political extremism at home, we've got the Agenda's Week in Review. I'm Nam Kiwanuka. It's Friday, January 15th, and that's ahead on the agenda. A new state of emergency and a stay-at-home order restricting all but essential trips took effect in Ontario yesterday. That on top of the strictest levels of lockdown already in effect in the province's hotspots. Can the new measures finally make the difference to flatten the curve of the second wave? Let's ask in the nation's capital, Dr. Vera Etches, Medical Officer of Health for Ottawa Public Health. In the St. Lawrence Market area of the provincial capital, Jessica Smith-Cross, Editor-in-Chief for the Provincial Affairs news site, QP Briefing. And in the Harvard Village neighborhood, Colin Furness, Infection Control Epidemiologist, and an assistant professor at the Faculty of Information at the U of T, cross-appointed to the School of Public Health. Thank you so much for being on the show today. Before we get into our conversation, I just want to go briefly through some of the new orders of the stay-at-home order, which came into effect on Thursday, and it's going to be in effect for about 28 days. Ontario residents must stay home unless completing an essential activity. Social and public gatherings must be outdoors and are limited to only 5 people. Weddings are limited to 10 people. Non-essential retail stores can stay open, but only between 7 a.m. and 8 p.m. No non-essential construction. Schools in the Windsor-Essex, Peel region, Toronto, York, and Hamilton will not return to in-person class until at least February 10th, 2021. Childcare for children too young for school will stay open. I'd like to get a reaction from all of you about what you think of these new rules. Dr. Etches, I'll start with you first.
Well, I think the stay-at-home order should make all of us think before we go out the door, is this essential? And if we are going to question those excursions and limit them, that should help us decrease the opportunity for COVID-19 to be transmitted.
And for Colin?
The situation is obviously really grave, and it's pretty hard to say we shouldn't be taking extreme measures. My concern is that a lot of spread happens in homes, a lot of spread happens in workplaces. The stay-at-home order is having its greatest impact on doing things like going and getting things that you need in your house, and that's not necessarily where the spread is worst. So we need measures. I'm not sure this actually attacks it exactly where we need it to.
And Jessica?
I think a large part of this is the message that it sends. The Ford government was trying to crack down on social gatherings. And even if not every part of this is enforced, I think they think a state of emergency and a stay-at-home order will send a message to people to take things more seriously.
And Dr. Etches, how similar are these new rules to the lockdown rules that were in place last week?
I think it's true what Jessica said. This is sending a message that you should not be gathering with people outside your household. So that change to make it even tighter around only go out with 5 people, those things all are trying to tackle that connection with people outside of our household, where we do see a lot of transmission coming from social gatherings.
And Dr. Etches, you were initially vocal against lockdown when it was announced before Christmas. Why?
I was speaking for Ottawa, and for the situation in Ottawa, the numbers then were very different. I'm fully supportive of this measure now, having seen our numbers quadruple in the last couple of weeks. So, people need to realize that it's not someone else. it's actually each of us doing our part to reduce our contacts with other people that adds up to turning the curve.
And Jessica, I mean, there's so much news happening. It's you step away from any kind of social media or television, something happens. Earlier today, York Centre MPP Roman Baber was still against the lockdown, and he urged the Premier to end it. Ford responded by kicking him out of the party. What do you make of that?
Yeah, that's right. He sent out a letter late last night opposing the lockdown and giving his reasons for them. Unfortunately, I think that letter betrayed a misunderstanding from the MPP. For example, one of the reasons that he said he's against the lockdown is that cancer surgeries are being canceled. And while that's true, they aren't being canceled because of the lockdown. They're being canceled because there are rising COVID cases in ICUs, and the lockdown is meant to sort of stop that from getting worse than it already is. He was kicked out of caucus this morning, and he won't be running again as a PC MPP.
Colin, when you see this happening, because I think the message we all got this week was that there was a lot of confusion about the new stay-at-home order. When people do see this, politicians kind of challenging this message, and the response is for them to be relieved of their duties, what do you think? What kind of message does that send to the public?
When there's mixed messaging, when there's confusion, I think people will have a tendency to revert to what they expect to hear, what they want to hear, what they hope to hear, confirmation bias. So those who are insistent on staying really safe will stay more safe. But a large swath of people who have been taking risks may actually really focus on I get to decide what's essential, and my morning coffee is essential. So we may be actually increasing the polarization of safer people staying even safer, and people who are engaged in risky behaviors maybe in some ways being a little bit worse.
The Premier released something on his social media yesterday after the stay-at-home order came into effect. Let's take a look. Sheldon, please roll.
My friends, stay home, stay safe, save lives. Stay home. That's it. Stay home. Everyone must stay home. Restez à la maison. We need to stay home. Save lives. It's very simple. Stay home. Stay home. Everyone must stay home to save lives. It's very, very simple. Stay home. Stay home. I don't know what more I can describe. Please stay home. Save lives. Thank you.
I want to get your reaction from all of you, but Dr. Etches, let me start with you. Is it really that simple, stay at home?
That is the core message, and many people can do that. There's a call again for people who can work from home. Now you must work from home, but many people can't stay home if they're performing essential services. So I think the other part is when you're at work, let's be doing all we can to support essential workers to have the tools they need to limit transmission in those settings. People need to have the ability to wear masks, to have distance between themselves and other employees, even during breaks. We find that this is really critical. There is still transmission in the workplace when people don't have those protections.
Jessica, is it really that simple?
I don't think it's that simple. A lot of people are essential workers, and a lot of the transmission is happening because they have to go to work. Some of the more weak parts of the new stay-at-home order is in that area. I'll give an example. Curbside pickup is still allowed no matter how non-essential the item is that you're buying. And what that means is that the people who are working in that boutique or makeup store or whatever that is getting your order ready and giving it to you still have to go to work. They may still have to ride transit. It's an example of how some people can stay home and get their goods online. Some people can pretty safely pick up their makeup or their new shirt, but the people who are working are at a higher level of risk.
And Colin, we've been hearing a lot from people saying that their employer is not allowing them to work from home when they can actually do their job from home. Dr. Yoni Friedhoff, who works at the University of Ottawa, he asked this on Twitter yesterday if anyone was working a job that shouldn't be essential, but their bosses are saying they are. He got answers such as an admin and assistant at a medical office that only uses paper charts, so they have to go in. A graphic design firm where the manager doesn't want employees getting used to working from home. A factory that makes parts. I think the politicians have been asking people to do the right thing, stay at home. But if you work for an employer who insists on you coming in, how much discretion does an individual have, or is that where the province should step in and mandate it?
That's incredibly complicated because I think we can't always second guess when an employer says, I need someone there. The province can't necessarily say, no, you don't. The employee doesn't necessarily have the ability to say, no, you don't. What I would like to see is really aggressive onus placed on employers to make workplaces safe, along with inspections, along with fines. So if you're an employer and you say, I really need my people here, okay, I want to make sure that absolutely everything's being done. That's expensive. That's difficult. If we put the onus on employers, they'll then have to weigh really how important is it versus the liability and the safety consideration. So I would like to place a lot more emphasis on the employer's responsibility, and I'd like to have a lot more investigations, a lot more inspections.
And Dr. Etches, you've been at the front lines of this, and I know in your private moments you must, it must break you to see the numbers climbing on all the suffering that's going on. And in that video that we watched of the premier, you kind of, well, my interpretation, it seems as if he was becoming more frustrated. What do you think is the disconnect with the message from the premier and to the public receiving it, or in this case, not receiving it?
Well, it is hard to see this virus, and people aren't always closely touched by it. You know, the majority of people may not know someone who's been hospitalized or who has died, unfortunately, from COVID. And so making those stories real has been important for us to communicate to the public how quickly this virus can spread undetected. It has asymptomatic infections. We know that it can happen with the people, especially happens with the people you most trust because you're close to your family and friends. And so it is getting a little bit away from that it's someone else's problem that affects all of us. We all need a functioning healthcare system. And, you know, the pressure on our system is very real right now.
And Jessica, you've been covering this story. I'd like to ask you the same question. What do you think is the disconnect with the message from the premier and to the public receiving it?
I think a lot of it, from my perspective, is because the worst things happen where we can't go and where the media can't go. So I do a lot of reporting on long-term care homes, but I can't go in them right now. So I hear devastating stories from families, from residents I can get on the phone, from PSWs, but there are no cameras going in there showing what people are living like. The same goes for ICUs. We've had a doctor describe what he sees when someone's dying in an ICU, talking to their family over Zoom, and those messages resonate, but we don't see them often because of people's privacy. The media isn't there.
And Colin, you know, the advice is don't leave home unless the trip is essential. There's a list of valid reasons to go out, including to buy essential goods such as groceries or medicine. But the government does not define essential goods. Frequently asked questions page was released by the government, and it said people should use their own discretion. How does someone enforce a rule that is based on people making their own subjective decisions?
I don't think you can enforce it. And I think that's a problem. If it's a problem for the people who are tasked with doing the enforcement, I can't imagine a conversation when I'm on my way to wherever it is I'm going with a bylaw officer or a police officer trying to justify. Everyone's not that far from a drugstore. I guess people can just say, I'm going to a drugstore. So I don't think the enforcement on an individual level on the street, it could work. And I don't think we should actually be trying to do that because it can't work. I'd like to see all those inspections go right back to workplaces. People walking down the street to get exercise, to get their goods, that's not the main problem. The main problem, I think, is workplaces and, of course, gatherings in homes, which is also really hard to enforce, even in the state of emergency. It's very awkward to think about the state peeking in living room windows trying to count people inside. So it's extremely difficult. And this is why, again, we've got a polarization of a large majority of people who are being really safe and a minority who are not. and are really, really driving the infections in a way that I think we can't enforce.
Once the announcement was made for this new stay-home order, there seemed to be confusion about who was going to enforce it. The police also seemed to be confused about what they were allowed to do and not do. It's also been proven that Black and Indigenous people are disproportionately stopped by police, charged and arrested. People who break the stay-at-home order could face fines of up to $1,000 or even jail time. What's being done to make sure that the law is applied fairly?
That's a really good question. The Ford government is trusting the police to enforce this fairly. We have heard from the Solicitor General's office since that initial confusion that you mentioned that just being out walking is not enough reason for the police to stop you to make inquiries about whether you have an essential purpose or not. But whether that is being followed will come down to the police officer. And you're absolutely right. Concerns about racial profiling that existed before this are being amplified now with this new order.
And also, someone being out for something essential could mean a completely different thing for someone else, right?
That's true. The law does have specific examples of what is essential. So they're broad and wide-ranging. They can include going to help somebody who needs help. They include being homeless, which is a good thing. They include going to pick up your curbside pickup, as I talked about before. They include all sorts of things, banking. But what we don't have a very clear picture of is what reasons will be accepted or how people will be believed. The Toronto Police have said that they're not going to require letters from employers to make sure that somebody who's going to work is actually going to work at the time. So when fines will be levied and how that will work through the legal system still remains to be seen. We don't know that.
And Dr. Etches, non-essential businesses and shops can stay open, but potential customers should not leave their homes to buy non-essential goods. How does that make sense?
You know, the rules and the regulations and the enforcement is not what's going to get us out of this situation, right? We, as individuals, care about protecting ourselves. We care about protecting our loved ones. And when people are given this clear message that actually this is a crisis moment, actually we are in danger again of losing the capacity we need in our healthcare system, you know, that clear message to stay home should be enough to turn the curve, as long as we are also making sure that those workplaces are safer for workers.
I just want to push back a little bit because I think studies have shown that a third of Ontarians aren't following the stay-at-home orders already. The majority of people are trying to do the best they can and keep their communities safe. You know, what else can be done beyond? I think right now we just have one solution, which is stay at home. What else do you think can be done to slow the spread of COVID and to hopefully bend the curve?
So yes, the goal is to turn the curve, and you know we had extra pressure on you know growing the amount of COVID in our community through the holidays. So I think we're coming past that period where there was more gathering than ever. You know, we're asking people, it's just come into effect. You know, this strong message to stay home. We need to give it 2 weeks before we'll see any impact because our numbers today reflect our actions 2 weeks ago. So we need to evaluate that and see how it's going. If stronger measures are needed, we'll have to look at closing more things to decrease the opportunity for people to come into contact with each other.
Colin, non-essential construction is halted, but there are many exceptions to the rules. 24 types of construction are still allowed, according to a list from the Daily Commercial News website. That list even includes residential projects and renovations as long as they began before January 12th. Are there too many exceptions?
I read the list and I was hard-pressed to find an example in my mind of something that actually couldn't go forward, apart from things that hadn't been started yet. That's a really tough one, and I'm not a construction expert, but what I would say is for sites like that, and I look at construction sites and I actually see less mask wearing than I would like to see, we should be doing mandating testing where we have workers who we think are in harm's way. If we are going to call them essential, if we're going to say this needs to go forward, then we should be doing very aggressive workplace testing. We would then get the data. I don't know how dangerous construction sites are for COVID. We'd find out if we would do testing. That's something, that kind of surveillance testing or proactive testing is something the province has not been very interested in doing. And I think it's a shame because we have some evidence from outbreaks of what kinds of workplaces are less safe than others, but we don't have a complete picture. And I think construction's on that list.
Some businesses are also doing rapid testing, so you think they should be doing more?
I think that there's two ways that you can control transmission. You can lock people up and you can test people. We've leaned very heavily on one side and really shown relatively little interest on the other. I think that's a problem. I think there's a huge opportunity for rapid testing. Not only that, home-based testing as well, so that we could tackle not only workplaces, but let people actually do a little bit of self-screening. Now, the sensitivity for some of these tests is a little bit lower. That's sometimes used as an argument to not use them, but I think that's self-defeating. I think to say that if we don't have a perfect test, we shouldn't look for cases is actually problematic. We can find some cases. We will be doing a lot better than not looking for any.
Dr. Etches, I want to ask you the same question. There have been many outbreaks at warehouses and manufacturing factories. Amazon fulfillment centers hit 400 cases in December in its 4 facilities in the Peel region area. In response, the government is providing rapid COVID tests to the company. Is that enough?
Testing alone is never enough. It's always better to prevent the infection in the first place. So if we're testing, it's already after the fact, someone's been infected. We need to prevent it with distance between employees as much as possible, mask wearing in the workplace, as well as screening people, making sure that people are very diligent about assessing whether they're well enough to come to work, and supporting people who are not well enough to come to work with options to access emergency social support if they need assistance to buy groceries or pay their rent.
I'm sure you're thinking ahead. What happens if this order doesn't work to get the numbers down, Dr. Etches?
Yes, as I mentioned, we're going to have to give it a couple of weeks to see. But, the goal here is reduce the contact between people. So we need to do that in as many ways as we can, asking people to do their part, closing businesses where needed. This is very challenging. There is no question. I'm very sorry to see the closures. What we want to get back to is a balance. COVID levels low enough to be able to keep schools open, to be able to keep workplaces open in a manageable way.
Do you think that this stay-at-home order should essentially just stay in place until more people are vaccinated?
No, I hope we can get to a level of COVID that's lower, that allows us to open things, that allows us to use our test and trace and contact tracing systems to keep the level of COVID, under control.
And Jessica, from your reporting, vaccines are supposed to be the game changer. And do you find in your reporting that maybe people have let their guard down a little bit because we now have vaccines?
I know that vaccine hesitancy is a problem. My reporting has covered a high level of hesitancy among the very first people who are supposed to get vaccinated because it's new and because it's unsure. And so far, we haven't had any sort of campaign from the provincial government that is helping to allay those fears. I hope that as time goes on and people see more folks getting vaccinated, that will go down somewhat. But so far, we haven't seen that.
And Colin, I want to ask you the same question I asked Dr. Etches. What happens if this order doesn't bring the numbers down?
I'm not confident it will. Again, the safe people are staying safe. The people who are engaging in risky behaviors, either because they choose to or because of their circumstances, I don't see that's going to change that much. And I'm very, very concerned about what's going to happen over the next few months. Whatever we do or don't do, COVID, I would expect to start to retreat somewhat as the weather gets warmer and, of course, at the same time as vaccinations go up. So I don't see effective levers we can pull. Perhaps an enforced curfew at night. We talk about not knowing how people can be doing essential things and leaving it to people's judgment. We could say at nighttime stores are closed and you got to stay home. That's the one enforceable thing we could do. We may need to add that. It's not clear to me how effective that would be. I think some early evidence from Quebec suggests that it has had a positive effect. So that perhaps would be the next thing I would point to. This is not fun. This is not a good thing to be doing in terms of people's mental health, in terms of civil liberties, but we are in a desperate situation. So I think in that circumstance, it's certainly worth trying. But we're going to have difficult months ahead. I'm sorry, I don't see an easy way out over the next few months.
Do you, would you recommend that we go back to how it was in March, where non-essential businesses couldn't open? Colin?
I think that what we did in March was actually fueled primarily by fear and unknown. I mean, we were finding people on park benches. I think we're in a very different place now than we were last March. However, at the same time, with the new extra contagious variant, things are going to be very, very difficult for us, even if we went back to what it looked like last March. But I'm not sure we can get there in terms of people being driven by fear. Fear has a short half-life. A lot of people are not afraid of COVID anymore. They're feeling confused, and that's going to be really difficult. Ultimately, it does get down to individual behavior, and we're seeing fragmentation in terms of what people are willing to do, what people feel they're able to do, and that's why I think it's, again, no easy levers.
And Jessica, there seemed to be a lot of, I think people expected the Premier to announce something different this past week. The Ford government canceled mandatory paid sick days when it formed government in 2018. A lot of people have been calling for them to be reinstated because people are going to work sick. But the Premier said that it's not going to do that because the federal government already has that covered with its Canada Recovery Sickness Benefit. Is that the same thing?
No, they aren't the same thing. And I want to say that this discussion has been getting louder and recently, and the people calling for paid sick days have included some of the people that have the Premier's ears. The Associate Chief Medical Officer of Health, Dr. Bioethics, has talked about this. The head of the province's Science Advisory Group, Dr. Stevie Brown, has mentioned them as well. So the difference between the federal program and what could be a provincial paid sick days mandate is the ease of access. If you're an employee who wakes up with the sniffles one morning, you don't know that if you stay home, you're going to get that federal benefit, even if you know that it exists. You have to have missed more than half of your work week, and you can't apply for it until after the leave is done. Plus, it's only $450 a week, and there's a whole process to it. It's not something that's going to make you think, okay, I can tell my employer that I might be sick, even if I don't know for sure it's COVID, so I'm going to stay home and keep my colleagues safe. It doesn't provide that kind of assurance to workers, and I think that's the key problem.
And Dr. Etches, I'll let you have the final word. Do you think that paid sick days are necessary in order to flatten the curve, in your view?
When we're following up with people who test positive, who've been in the workplace while sick, we do find people who say they chose to work because they needed to buy food for their family. And we need to take that difficult choice away from people, whether to buy food for their family or to, protect their coworkers. And there's many different policy options to explore, but that is important.
And Colin, we have a few more seconds. What do you think?
I think paid sick days are vital. The problem is for precarious workers, however, you also have to trust that you're not going to lose your job after claiming some paid sick days. Precarious workers, marginalized populations that don't have trust, that don't have a safety net, that don't have a voice, this is a big problem. And so whereas paid sick days are vital, I'm afraid for many they won't be enough.
We appreciate your time. We know you all are busy working. And Dr. Etches, it's a pleasure to have you on the show because we've been trying to get you on the show for a while. So thank you very much. Jessica, Colin, Dr. Etches, thank you so much. We appreciate your insights.
Government policy can seem remote or irrelevant, but as the pandemic has shown again and again, it matters. And as Ontario faces another state of emergency, the province's crisis triage protocols have become vitally relevant, particularly to older people and those with disabilities. Sarah Trick is an Ontario Hub's editor. She's been on this story, and she joins us now from Ottawa. Welcome to the show.
Hello.
Now, just before we get started, so that everyone is on the same page, let's have a look at this. What is crisis triage? A crisis triage protocol is activated in the case of a public health emergency, such as a pandemic or natural disaster, when the demand for medical services dramatically exceeds the supply. A triage protocol is a set of guidelines to determine the allocation of limited medical resources during such an emergency. The principle of triage is to save as many lives as possible by prioritizing emergency treatment according to criteria often including the person's chance of survival or life expectancy. For example, under a triage protocol, it could be considered justifiable to remove an older, frailer patient from a ventilator in order to save a younger patient. When the priority of patients can't be made based on medical need, some triage protocols determine treatment by first come, first served, or lottery system. So Sarah, for your latest article for TVO.org, you looked into Ontario's triage protocol during the pandemic. What have you found?
So I've been following this issue for several months now, and as soon as I heard people talking about the idea that eventually care might have to be rationed, I wanted to know basically what the disability community was saying about it. I have a disability myself. I use a wheelchair, as you can probably see, and I do know that people with disabilities can face a lot of discrimination in the medical system. So I wanted to make sure that whatever protocol we were using wasn't discriminatory. What I found was the protocol's been developed over several drafts, and especially in the earlier drafts, there were some criteria that people would have been excluded from treatment that disability advocates did think were discriminatory. And then the other main concern people had was that the protocol wasn't made public for a long time, and it still hasn't fully been made public and hasn't fully been adopted, so there's a lot of confusion around it. So it is important to note that in response to feedback, the bioethics table did limit the use of the clinical frailty scale, so it's not used as much as it would have been otherwise. It is still one tool that is used for triaging, but the protocol has been revised to try to incorporate more of an equity and human rights framework. So there are still issues that the disability advocates have with this protocol, and they're still very concerned, but the new version of the protocol has taken their feedback into account. Whether that's going to be the final version of the protocol or whether that's going to be the version that everybody uses remains to be seen, but there has been some movement on these issues.
So as you mentioned, one of the criticisms from advocates is that the protocol wasn't made public by government. Let's talk about the other criticisms. I understand one that was mentioned in our show earlier this week, and we're talking about the clinical frailty scale. What is that, and how does that come into play when we talk about the triage protocol?
So the clinical frailty scale is a tool to use to assess frailty in older patients. So what that does is it measures a patient's ability to perform certain life tasks independently. So one of the tasks, for example, is being able to get dressed by yourself. Another one is using the toilet by yourself. Another one is can the person manage their finances independently? The idea is the fewer activities you can do by yourself, the more frail you're likely to be. This wasn't necessarily developed as a triage measure. It was developed, in fact, to figure out what kinds of care older patients might need. But it has been used as a triage measure, especially in older people. What the advocates were concerned about with this measure is, especially for people with disabilities, we might score differently on the test, even at baseline, than we would when we're in the hospital. It might have nothing to do with our medical prognosis of COVID at all. Like, for example, I've always needed help to get dressed. I've never been able to do that by myself. I likely never will be able to do that by myself. Does that have anything to do with my life expectancy as a 32-year-old woman? It's doubtful. And this measure has never been validated in younger patients.
I want to look at a certain ICU situation. Who would be deciding whether a patient receives treatment or not?
It would be doctors, and ideally it would be doctors in consultation with the family. So, for example, if a family member or a patient or family, so if a patient is conscious and can make their own decisions, and they know, for example, that they don't want to be on a ventilator, or their family member knows that they wouldn't want to be on a ventilator, they can hopefully tell the doctor that. But when it comes to people who do want critical care and there is not enough there to allocate it, then that's when doctors will be making the decision of who to exclude.
Is there an appeal process at all if a patient or a family member, thinks that the treatment that they're receiving is not adequate enough?
It seems as though if there is one, it's fairly limited.
Now, what are we talking about when we talk about the conversations with government about the delay in implementing this policy?
So, I mean, it hasn't needed to be implemented just yet anyway. Like, we haven't been at a surge capacity, but there has been a delay in making it public. And even the bioethics table, who did write the protocol, all the versions of the protocol, and pretty much all the organizations who consulted on the protocol, they've all said, and everyone on the agenda panel that happened this week said, these protocols need to be made public. The public has a right to know what sorts of decisions doctors will be making.
When we talk about pushback, you had mentioned a little bit from disability advocates, but are we hearing anything from the opposition?
I've heard very little. I think I've seen possibly one comment from an opposition politician about this. And I do think that the reason for that is disability politics aren't necessarily partisan in the ways that we might think of some other equity issues being partisan. And in some ways that can be good because there can be more cooperation between parties on certain measures or certain policies. But I do think that there is a political consensus pretty much that people with disabilities might just be more vulnerable anyway, or we are more likely to die from the virus, and there's nothing that can or should be done about that.
Now, maybe the question is then, how does the triage protocol apply to patients without COVID-19? Does it?
It will apply to all patients. Mm-hmm. And I've read a couple of different drafts of the protocol, and they all have like fairly granular charts that basically say, this is when these patients will be excluded, this is when these patients will be excluded, and it goes through a whole bunch of different conditions. So like burns, for example, here's the conditions where we'll treat somebody with this percentage of burns, here's the conditions where we won't. Heart attacks, strokes, major traumas like car accidents. So I think when people think of these triage decisions, they think of their own personal risks from getting COVID, and they think, oh, well, I've been mostly safe, so probably like this won't happen to me. But if the hospitals are in a surge or a crisis moment, and you walk across the street and get hit by a car, you are still at risk of being triaged out, depending on your condition. So I think it is an issue that everybody should care about because it does impact everybody.
One thing that you had mentioned was the term vulnerability. At the beginning of this pandemic, the directive from this government was to protect the vulnerable. Do you think that message has gotten through, or do you think that it helps at all?
I think it was well-intentioned. I think I've noticed an evolution, and it's concerning to me because I believe in the beginning of the pandemic, it was all, everybody was like, yes, let's band together to protect the vulnerable. And then now it seems more, let's exclude the vulnerable so that I can go back to my life. And there's a lot of issues with this. And the main one is you don't know if you're vulnerable or not. There's so little that we know about this virus anyway. And a lot of people have comorbidities or conditions and might not even know it. If you think that you are healthy and you have no risk of dying from this virus, I would ask you, have you checked your blood pressure recently? You don't know if it's high. Have you looked into like any other of these factors? Like anybody can be vulnerable. And in a surge situation where there's little capacity in hospitals, everyone is vulnerable because lack of trained staff will mean that a lot of people won't be saved who could have been because people are burnt out and they're not able to provide the same care to patients that they would.
Sarah, I want to thank you so much for coming on our show tonight and sharing a very important story. That is Sarah Trick, our Ontario Hub's editor. Thank you again.
The agenda this week: consider the foreign affairs landscape as this new year begins, and scan for signs of political extremism in Canadian politics. The agenda's week in review begins with a panel our Ontario Hub's editor just mentioned on the province's crisis triage protocols.
The bioethics table, I think at no point really said that they felt that the protocol or the document that we produced was unjustifiably discriminatory. What we are trying to do is that we have a number of principles and that we're trying to sort of balance here, right? That broadly speaking, it's the desire to save as many lives as possible, but also to be very procedurally fair and try to make sure that we're not, disproportionately affecting one population or another. And as you're trying to sort of defend human rights, but also protect human lives, trying to find the way to best balance that is hard. There's no one right answer.
What we're talking about, and this goes back to what Professor Checklank said and a little bit about what Dr. Downer said, about this balance between ethical principles and the human rights framework. And they've been equated from the very beginning within this triage protocol. And that's problematic for several reasons. The first one is ethical principles are just that. They're principles. The human rights framework that we have are quasi-constitutional rights that are bestowed upon all of us. So you shouldn't be drafting a triage protocol to answer questions like the one you just posed by looking at ethical principles. You should be looking at a human rights framework. Second, the ethical principles that do guide this document are, some of them in and themselves, discriminatory. By way of examples, utilitarianism, which was mentioned at the top of the program and has also been mentioned by both Dr. Downer and Professor Checklank. Utilitarianism talks about the maximum benefit of good for the maximum number of people. The problem is that when we look at this, persons with disabilities hardly ever comprise that maximum group of people that have received that benefit. So the ends justifies the means, which pretty much is utilitarianism, will always be discriminatory to persons with disabilities.
But if you don't use that philosophy, what should you use?
The human rights framework. And the human rights framework talks about A, the duty to accommodate, and B, up to the point of undue hardship. It's not this idealistic idea of fairness. It's substantive fairness as set out in Section 15 of the Charter. So to dilute or to equate ethical principles with human rights framework is to dilute a very robust system. And just one more point on that, Steve, to say that we just don't have time, we're in a pandemic, we need to be efficient. This is the type of scenario where human rights matter the most. Human rights aren't triggered when things are easy and people are living a happy life. Human rights are especially triggered in these most dire of times, and we can't trample over them for the sake of efficiency and by trampling them by putting in ethical principles as taking primacy over human rights. I don't think that's appropriate.
Okay, Udo Schuckling, can I get your view on whether we should take a more human rights-based lens as we look at this issue versus a more philosophically utilitarian lens on this? What's your view?
Well, I'm biased here. I am a utilitarian, so I do care about outcomes. And that's the nature of healthcare systems. Healthcare systems always try to maximize human well-being. I have issues with the human rights argument because the truth is none of these charter rights are absolute. They can all be overridden, provided we have a good justification for that. So what the previous speaker has just done, basically, she has hidden behind human rights rhetoric, but she dodged her question. And the question remains. If you have somebody who is in a hospital setting, and I worked many years ago in South Africa, so I've actually seen this as a clinical ethics person, like I was on the bedside. And you find yourself in a situation that there's a patient there that is on a ventilator, has not a really good outlook in terms of survival, and there's somebody else who needs access to that ventilator. And you know that this person with a much higher probability will be able to leave that hospital. Are you then going to, as the previous speaker has just done, no, we can't do this and we must not do this and outcomes apparently don't matter. It's all about rights. Are you really then saying, okay, we stand by, we wait for this person who could have left the hospital to die, and the other person is also really going to die, but we certainly will not wean that person off the ventilator. Suffice it to say, in South Africa, of course they have weaned that person off the ventilator in order to save this other life.
David Lepofsky, you want to weigh in?
Dr. Danner and more significantly, Professor Shuckling may give you ideas from the point of view of bioethics. I'm sorry, but we live in a country that's governed by law and the rule of law. And some of what Dr. Shuckling just took as utterly acceptable would, I think, need to be explained. Someone need to explain to me why it is not culpable homicide under our criminal code. And you can't, even underlying all of this discussion has been even this implicit premise that somehow the government can send a memo to hospitals deciding who lives and who dies without any proper legal authority. Now, the bioethics table in its most recent writing has suggested a greater recognition that we need to have a legal support. But I'm telling you categorically, any doctor who does what Professor Shuckling just said without legal authority better be consulting a lawyer, and fast.
John, to you first. To what extent do you think that the anger we saw in Washington last week exists here in Canada?
Well, it is a truism that everything that happens in the United States eventually happens in Canada, and to a lesser degree. So it is probably true that the kinds of resentments, the really unfortunate and regrettable nativist resentments, the resentments of the rural towards the urban, the cultural resentments that fired Trumpism are here in Canada as well. It's probably also true that thanks to social media, the transfer across the border of the tensions between progressives and conservatives, the rendering of that debate from "I disagree with you" to "you are illegitimate in my eyes," is going to happen here faster than it might have happened in the past. My deep, profound hope, of course, is that this is a much more stable society, a much more consensual society, a society that still retains fundamental levels of trust in its institutions, and that whatever stress we receive, we will be able to endure and overcome. But we're going to have some of it. There's no question about that. You see it already on the social media feeds if you spend, as I do, far too much time on Twitter.
Well, this is not an academic discussion for one of our guests today, because Supriya Dwivedi left her talk radio position not too long ago because some of the stuff that she was seeing, she felt she wasn't getting very much backup from the managers of the place where she worked. Supriya, I wonder if you could fill us in on, to the extent that you can talk about this, fill us in with some of the details, if you would.
Well, I think it really started to manifest itself in the aftermath of the Quebec City mosque shooting, where we all sort of got into this national debate over whether or not the House should pass a non-binding parliamentary motion condemning Islamophobia. And there was a large amount of misinformation and disinformation that was being put on the airwaves, not just on, the talk radio station that I was on, but really across the country in terms of tabloid print and talk radio in particular. And I would notice, for example, whenever my show did a fact-based piece on the Islamophobia motion, and some of the other shows, were trafficking in some of that mis and disinformation that I was referring to, I would see a direct correlation in terms of the kinds of things that would end up in my inbox and just the sheer volume of it. And for me, it became sort of this constant cycle that whenever there was something in the news cycle that had to do with immigration, that had to do with visible minorities, that had to do, with race more generally, I would start to see an uptick in hate. And I don't think there was, my contention is I don't think there was enough necessarily done to try and curb some of the mis and disinformation that was being put on the airwaves.
Now, you had a white male co-host, yes?
I did. I had two co-hosts that were both white and male.
Did they get the same kind of stuff?
I mean, they definitely got it, but I don't think they got the same in terms of volume and in terms of content. Matt Gurney, my first co-host, described it as it would be like, oh man, you suck. Whereas I would get something like, you suck, you bleep stained C word, and I'm going to rape you. So very different in terms of the content.
You got that?
Oh, regularly, yeah.
Okay, Barbara, let me bring you into this conversation here. While the events that were taking place at the doors of the U.S. Capitol were happening, we had our own little Made in Ontario event take place in the streets of Toronto as well. There was a caravan of, well, there were a bunch of pickup trucks driving around downtown Toronto with lots of pro-Trump flags and pro-Trump slogans. And I wondered what you thought about that when you heard about it.
Well, I guess I wasn't surprised, and I should say it wasn't only Toronto either. There were similar protests, not the caravan so much as gatherings of individuals in half a dozen cities across the country. And we know that there has been support for Trump since he first ran in 2015. In fact, his campaign, and so they were Canadians for Trump that emerged immediately after. He began to run, and they're still active, and that's certainly what we've seen. And there is, sort of sympathy for Trump and his plight, as they describe it, but also for some of the other ideologies that support the patriots, as they framed themselves in Washington last week. So we do see sort of an anti-authority movement in Canada as well.
I have to reject the idea that China is interested in cooperating with us. And when I say China, I mean principally the Communist Party in charge of it, not the people. What we've seen in China is a project in lifetime rule through President Xi Jinping, in which it would see the Middle Kingdom, China, rise and replace the international order of the post-war era. I think that what Beijing sees when it looks around the world is a collection of half-hegemonies that feed its own political, military, and economic growth, and that it sees itself in a position to build a new system to rival that of the West. And so I think that China has replaced Russia as the West's principal rival. In many ways, it's turned Russia into a gas station supplying its own energy interests, and that we need to be very lucid and very clear about the threats that China poses to the world order.
Peggy, rival or enemy?
Rival, absolutely. And I think that it's time to really call out this conflation of Chinese internal authoritarianism with external aggression. Its defense strategy disavows defense superiority, hegemony. And in straight defense terms, I mean, China has about 320 nuclear weapons. United States warheads. The United States has around 5,000. United States' defense budget dwarfs China's. It's bigger than the next 10 countries combined, including China. United States has 800 military bases around the world encircling China. China has one foreign base, naval base, tiny naval base in Djibouti. Let's look at the actions. Let's look at the capacity of the country. Let's look at its stated intentions. China has a no first use nuclear policy. And I think that this hyping of the China threat, when China is behaving fundamentally like a great power, serves the interests of the defense lobby, but ill serves a globe where engagement on climate change and on health, to name two, and there has been good cooperation on health in spite of all the hype, are global imperatives. Those are the global imperatives.
Well, okay, let me, I'm going to set up Chuvaloy to come back at you here because I saw him shaking his head in the midst of that answer. But the fact that they're holding two of our people hostage and share very few of our values may have something to do with that. Chuvaloy, you want to come back at what you just heard?
I think that the understanding of threats probably requires a bit of an update. I mean, we've seen China be a belligerent on the Indo-Chinese border. We've seen China be a belligerent in South China Sea. We've seen China use informal fishing vessels to harass the Australians. We've seen China use and weaponize commerce to harass the Australians. Their oppression of the Xinjiang minorities of the Uyghurs, Muslims in their Northwest province. We've seen China not cooperate on health in the World Health Organization. There's been no evidence at all that China is actually acting as a great power that would be a partner of the West in our shared mutual interests. If anything, we've seen China become a belligerent geopolitical rival at the expense of Canadians like Michael Spavor and Michael Kovrig, at the expense of 200,000 Canadians who are in Hong Kong. I do not believe that there is any remote equivalence between American power and China's asymmetric power projection. And I think that when we think of Canada's role in it, we're not caught between China and the United States. We are clearly in partnership with the United States and other democracies around the world, and we should make those partnerships more accessible to new partners like India, Japan, and others.
James Steinberg, where are you on China's alleged hegemonic interests?
Well, I don't know if it's hegemonic, but I certainly see it as a great power that doesn't hesitate to coerce others when it can to get its way. And I think that's the most troubling thing about the evolution of Chinese foreign and international policy, is that basically the Chinese have decided that they're going to get their way whenever way they can. And if they can get it through coercion and intimidation, they will do that. And only when they find that they can't get it that way do they tend to turn to trying to cooperate with others.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, January 15th, 2021. Next week, we assess Canada's immigration system during COVID and consider what's been accomplished 5 years on from the Truth and Reconciliation Commission. Also, 1 week tonight, we launch an ambitious new series in partnership with the Toronto Star, examining the future of democracy. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a wonderful weekend, and Steve will see you on Monday.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman. And by viewers like you. Thank you.